And let's get started. Today, we're going to talk to you about best practices for educating patients in the community. And so we have Chaia and LaToya that will be speaking with me regarding these best practices. So welcome to the Navigator Focus Training. CA Bridge is a part of the Bridge Center under Public Health Institute, and we receive report from Department of Healthcare Services. So today for the best experience, please make sure the number 3, the middle bullet here, use chat for questions and address to everyone. Nobody will see your question, so they don't know what we're talking about. So if you have a question, put it in the chat and make sure the blue little title line does say everyone and not just hosts. So CA Bridge, our goal here is to provide 24/7 access to substance use navigation and addiction treatment in every California hospital. And we are pretty much all over the state, very small amount left. We're like, a B grade, 80%. We didn't get quite all of the hospitals, but we're still trying. I'll let you know when we do. CA Bridge model. I always like to stop and review this because we want to make sure everybody knows what our model is because we're revolutionizing the system of care. There's 3 pillars. The first is low barrier treatment. That's what the doctors and nurses and practitioners, they're all giving low barrier treatment in your emergency department or at your clinic. The last 2 pillars, connection to care and community and a culture of harm reduction, are really our navigators, our CHWs, our peer support specialists. You guys are making that happen by linking patients to follow-up care as well as reducing stigma and biases in our communities. So thank you for all of the hard work. I know some of you do this work alone. And again, we appreciate you. We know you are out there working hard. So announcements for this month. Well, if you don't know, we have a Navigator update. LaToya leads the Navigator update, and this is a time kind of for some discussion. These Navigator focus series are about training. The Navigator update is more about really hot trending topics and a discussion Q&A session. So please come. The next one is May 7th for fentanyl awareness, frequently asked questions, 11 to 11:30. Navigator focus series for the next 2 months. We're going to be talking about chronic pain and opioid use disorder with Dr. Alicia Gonzalez, May 22nd, and June 26th will be all about our veterans and engaging those populations. We also have our Navigator peer support that Chaia Vang leads, and we invite you to this really safe and supportive environment to share experiences, to de-stress and debrief. Because we know, again, you're probably the only one in your has the role and title of a navigator. So that will be at the end of this month, Wednesday, April 30th. So we have a really huge, big announcement because some of you did receive your CHW certification in June. Your renewal will be coming up. So we just wanted to make sure that you were aware of the Medi-Cal requirements for your annual renewal of your CHW certification. You need to complete 6 continuing education hours within 1 year of your certification. Where do you think you guys can get them? Here at Bridge. You can attend our Navigator Focus series. We are also started our new regional collaboratives, and those we will also be giving CEUs, as well as our CA Bridge Academy training sessions. So please make sure, reach out if you're not clear about this. You must complete the evaluation to get a CEU. Sorry, you just can't attend. These are the approved CEU sessions that you can get for your renewal. 1 hour equals 1 CEU. So again, if you have any questions, let us know, mentors@cabridge.org. What we need you to do, there's no place to turn them in. You just need to keep copies of your CEU certificates, keep one for yourself and provide one to your supervisor. So that way, if there's any audits by Medi-Cal, you will have your CEUs in your folder and say, I've completed these. So any more questions, please let us know. Talking about our CA Bridge Regional Collaboratives, we're really excited about these new sessions. We've just had two, one in Fresno, one in Sacramento. If you joined us, we really appreciated it. There was some great community conversations going on, and that is the whole goal, is to network and collaborate within your own communities, your own regions. We are having these in person as well as virtual. Our next virtual is for everyone in the state, and we'll have breakouts in your regions, and that will be Tuesday, June 3rd, 9 to 10:30. 10:30, it's an hour and a half. So just make sure, put that time on your calendar, Tuesday, June 3rd. Bring a friend, bring a clinic, bring somebody who wants to know about CA Bridge, anybody interested in the SUD field and really wants to advance MAT access. That's what we're here for our regional collaboratives, is to expand access to low barrier MAT treatment. Our in-persons, we're coming to you in June and July. Central Coast is coming up, and it will be registration will be on our webpage soon. So just save the month. Central Coast in June, and July will be Inland Empire and LA. So more information to come on our website. It's not there yet, but give us some time and it will be there for registration. We will also make announcements on Slack. So here are today's objectives for CEUs. Again, if you are coming up upon that CHW renewal, very important that you know our objectives and that you complete the evaluation. In the post-event email, you will get an evaluation. There's also a deadline on there, so you must complete it. Our agenda today is we're going to talk about 3 topics: patient-centered care with Chaia. I will be talking about harm reduction education, and LaToya is going to be giving a tutorial for our CA Bridge resources, because I bet there's some you didn't even know about, because we forgot about them too. So we're going to save that for the end. So I am going to hand it off to Chaia Vang.
All right. Hello, everyone. Let me give me a few minutes to try to see if I could do this. In the meantime, let me know what comes to mind when you hear patient-centered care. And I can't even see the chat, so I hope you are all entering something in there. Oh, I see it. All right. So I'm going to talk about what is patient-centered care and substance use disorder. I just want to make sure you all see my PowerPoint. Yes. Okay. I don't hear anything. So yes. Yeah. So for patient, being easy for the holistic, individualized, perfect, providing for the patient what they recognize as their needs. Yes. Thank you, everyone. So what is patient-centered care? It really emphasizes when the individual is emphasized as the center of treatment and not the diagnosis. We want to really focus on the whole person's physical, psychological, social, and spiritual. And it is when the patient's values and preferences are respected, right? Recognizing that recovery journey is different for everyone based on their values and their goals. And it's also so important to remember that the patient is the expert of their own experience. So, yes, thank you for the answers that are coming in through the chat. I can see them now. All right. So why does patient-centered care even matter, right? we want to build the trust with the patients. So that requires meeting patients where they are physically and mentally too. The patients may not see you as someone helpful if they don't feel like they are represented or understood. So that comes with cultural competence and representation matter in establishing rapport with them. Um, the basic needs must be addressed before education is even enters the conversation. So when the patient is worrying about food, shelter, or immediate crisis, they cannot focus on treatment. And that's when we need to know if the patient is ready or not to even listen to us. Respecting the patient's autonomy really improves outcome, and we all know this, right? Patients feel much more respected and are more likely to engage meaningfully when they have autonomy. One example that really comes to my mind are when patients are definitely in the emergency room from an overdose. Not only are they sick or overwhelmed, just being in the hospital, they don't want to talk. Um, so what can you do what can you do for those patients that are in that situation? Offer to reconnect with them when they are ready by asking if you can call them at a later time, or giving them your number so they can reach out on their own terms when they are ready. Like I said, the patient must be ready to learn and accept whatever it is, the resources and the education we are going to offer them. So I'm going to go over some of the core principles, which is definitely respect for patients' values and preferences. Some, such as patients may prefer you to communicate with them through text messages or aside from phone calls. Um, that's also respecting patients who want to have their treatment information shared with their family member or a parent or even their neighbor. And just remember to definitely document their consent for information sharing. And I feel that the next two core competencies, core coordination and integration of care and information sharing and education kind of overlap just because by providing your patients with all the available resources and a clear explanation of treatment options and evidence-based treatment practices such as MAT options, the different levels of care available. You probably know more than me. So there's like inpatient, outpatient, telehealth services, primary, mental health. You can really empower informed decision making for your patients as they become more active participants in their own journey. um, Trauma-informed approaches. When you're able to recognize that patients are triggered, depressed, or dysregulated, you can really give patients that emotional and physical space to decompress. Normalize that emotional responses, especially when patients are in the hospital or being in that chaotic emergency department. Just normalizing that their feelings are valid. Tell your patients that it is okay to share that they're distressed with the staff because that is appropriate. Saying, being here, just stating these words, being here makes me feel anxious, or I'm feeling scared now. So building those emotions vocabulary will help patients name what they're experiencing. And that's also a very great self-regulation skill development that patients can learn too. Like I said, just validating that all emotions are a normal process, a normal response to recovery, can really help with that whole the trauma informed. And then also teaching your patients that having that family and community involvement can be a key to recovery, because having the support is very sustainable when they are in recovery, beyond treatment, and definitely reduces isolation, which is a key trigger to patients to return to use again. Um, Okay, so here are some effective strategies that you can use to help educate your patients. Motivational interviewing techniques. You want to ask open-ended questions, such as on one hand, you mentioned wanting to stop, but on the other hand, you said it helps you cope. Tell me more about both sides. This really opens up the conversation. Um, decisions, share decision-making process, presenting the choices clearly and without being overwhelming to the patients, and consistently checking in, making sure they understand. What questions do you have about these options, or asking, how is this working for you? How is it not working for you? And then, like I said again, trauma-informed approaches, emphasizing that the patient's choice and control. You get to decide which options feel right for you. By telling them this, it just really helps them feel like they have much more control. And then help your patients identify triggers and coping strategies. Cultural competence is a real big one. We could go on and on about it, right? But definitely addressing language barriers, offering qualified interpreters, not just family members. That definitely really makes a difference. And then having translated materials in preferred languages. Um, you can also ask, incorporate in healing cultural healing processes by asking, are there any traditional practices important to your recovery? And then helping your patient connect with the cultural community resources to continue that connection. Um, this part here, I'm going to talk about how to engage communities in patient-centered care approaches. So obviously, we want to start off by reducing stigma around substance use disorder and treatment barriers. You can really do that as in your current role by leveraging personal recovery narratives and sharing success stories from people in recovery, sharing your own patient stories that have been successful. Um, what are some, and then also educating patients about supportive roles and defining what healthy support looks like in practice. So by doing that, setting healthy boundaries, telling patients, family members to say, I will not give you money when you're actively using, but I will help you access treatment. Recognizing what are enabling behaviors versus genuine support. So an example of that would be offering to drive them to counseling appointments versus offering to drive them to buy substances. Um, Providing houses with clear rules versus ignoring substance use in the home. And then next is building community partnerships to make seamless care coordination and warm handoffs between services, just to continue the ongoing navigation that is included and not limited to employment, education, housing resources, social services, services for justice-involved individuals. We could definitely go on and on about the additional services that's needed, right? And then really, you can really advocate for patient-centered policies and procedures to help reduce systemic barriers. This has been a kind of like a hot topic in our regional collaboratives. You can really advocate to minimize potential re-traumatization, such as urine drug screens. We still hear that is still being required as part of intake processes. Share California Bridge's goal as reducing barriers and increasing access to medication-assisted treatment programs. Support harm reduction initiatives such as naloxone distribution and fentanyl test strips, having that at their service sites. And then just really promote recovery-friendly workplaces and hire more people in recovery when possible, to really create this patient-centered care approach. So now I'm gonna share so that was a lot, I'm gonna share a patient encounter that really highlights cultural humiliation. Um, Something that I actually put into practice. So many of you may still know that I am still a navigator at the hospital, Community Regional Medical Center. So we all know that patients have the right to receive services in their own language. I don't know how it is for others, but for me personally, I have experienced challenges with language barrier myself. There were times when I couldn't translate for my own family member, and I watched like services using third party to translate, and I could see the frustration or even the lack of support built with my family members as a patient, or even on the provider side too. So recently, I had a patient encounter where for a Hmong speaking patient in my hospital, definitely I did a quick chart review and saw that the floor social worker had already went to go see this patient using a third-party translation line. The patient already denied to receive new resources, but I was just like, I'm just gonna stop by and say hello because I do speak this patient's language. Um, and I was really proud to use my tier 2 badge that I received for Hmong. So I walked in and I said in Hmong, "Hello, Grandpa. My name is Chaia. I'm here to talk to you about your drinking. Is that okay?" And like his action just like stunned me. He started crying. He said, "Yes, yes, I need help. I want to stop drinking so much. I just can't." And then just listening to his story, he shared that he has done plenty of inpatient programs in town, but in all these programs that he's done has had no translators there for him. He was just there to kind of pass time using his like broken English and such. And so he really wanted a service that can have a counselor or therapist or clinician or anyone there that speaks his language, which is Hmong, so that way he can meet face to face with them and really tell them what he needs. So this patient has had private insurance, so it was almost impossible to find him a resource that offers him the Hmong service too. So I use most of my connections in my community were Medicare accepting, and they would not even take him because they're like, oh, we don't take cash pay. So I took like 2 days trying to find him a resource. Even after I had left my shift, I had called people, left so many messages. Thank goodness one of my contacts I have had from a recent clinic I was at, I had called him and I was like, do you know of a program that offers have a Hmong speaking counselor? He was like, me, I work at another service too. I'll refer him there and I would see him. I was like, oh my goodness, he just made my day. So obviously from a patient there, I even like referred, I texted him the day of his appointment. I called him to remind him where his appointment was. He was so excited. He was like, I'm getting ready. I'm gonna drive there. So I was scared he was gonna get lost, but he made it. And then like a week ago, it's like this training is perfect timing because a week ago he called me. He was like, I'm gonna go on a trip to out of town, but I wanted to let you know because I thought it was only right that you knew where I was going. So I was just laughing. I was like, oh, have fun, come back and let me know how you're doing. So I just really want to share that story and how it was so important for me to get my patient connected to the services that he needed um, to fit his needs. And then I am gonna pass it off to Sherrie.
Well, how do I follow that wonderful story? That was absolutely wonderful. Thank you, Shia, for sharing. I love to hear those success stories. And that was a patient-centered approach. I don't think anybody could have gotten through to him except you were at the right place at the right time and you spoke his language. And, sometimes it's just perfect timing. So thank you again for sharing that story. Like I said, that's a hard act to follow, you guys. So I am here to talk about harm reduction education. I feel like you guys are the experts on this, probably mm, just as much as I can talk about it, so can you. But what comes to mind when you think of harm reduction? Because I hear it a lot lately. So type it in the chat. What words come to mind? For some, it's naloxone. It's safety, it's safe practices. I want to hear, what do you guys are the experts here. I'm just I'm facilitating. What do you feel, what words come to mind, you guys? I'm going to take a minute. Narcan, safe needles, safe needle exchange, safer way to address SUD. I like that. Safe needles, not using alone. Methadone, Matt, you guys are all right. Like I said, you know, you guys can give this talk. Education materials, I love that. That's why we're here today, is to talk about education. So these are all correct, as well as everything on this list. And it is safety, yes, willing to explore safety and using safely. So again, thank you, because I knew you guys know this stuff. And my point of this asking, you guys are the experts. You hear these terms all the time, every day. This is where you live. This is your world. But for some people, including in healthcare, you may be the first person that somebody has heard that talks about harm reduction. So don't think that everybody knows what harm reduction means, what it is. You'd be surprised of hospital staff, medical professionals that really maybe didn't get this training back in the day. I know I've been a nurse for 30 years, and harm reduction wasn't trained to our nurses back then. So again, some people have never heard of this. So don't think that everybody has it, and just meet everybody where they are at. I want to just remind you, you know, we have patient education, we have staff education, and we have community. And I think you guys really do a great job with patients. I think that's the expertise that you guys all have. Now, with staff and community, I want you to have that same confidence and use those same skills, because lately I still am on call at Pomona Valley Hospital, and I had a peer support specialist with me. And she was scared to death when I was teaching her and training her to teach others about naloxone, how to give a demonstration. And I share this story because it really gave her confidence, and I want you guys to have that same confidence, because the story I gave to her is, you know, 4 years ago, 4.5, 5 years ago now, oh my gosh, 5 years ago, we started our naloxone program at Pomona. And we started having resource fairs, and every nurse, you know, wanted to know about naloxone and wanted a box of naloxone. And so we were giving it out at a training, and a healthcare professional came up and said, "Oh, I need one of those naloxones for my emergency backpack I carry with me. I go to a lot of parks. I'm a soccer player." So they really knew what they wanted and came up. And, you know, I work in the ED and very confident. And I said, "Okay, well, do you need instruction?" "Oh, no, I give it all the time, you know, just pass me," you know, didn't even listen to the words I said. So I said, "I know you give it in the emergency room. Have you ever given the nasal spray out in the field in the community?" And he stopped, turned his head, and said, "No, I have not." I said, "Well, let me open the box and let's show you what's in here, what it looks like, so that way you're an expert." And they like that. They like that a lot. Yeah, yeah, I want to be the expert. And so I just let you know, don't think that everybody knows everything. You are the expert. This is your world. This is where you talk about what you talk about on a daily basis. So have that confidence, even to staff and the community. Always, you know, pick a topic and, you know, just explain it, because people have lots of questions, especially if they don't know what it's about. Educating the community, I really think harm reduction is taking little pieces of it, right? Because look at this screen, look at all of these words. It's a lot of stuff. Sometimes even our community is not ready for everything. Meet them where they're at. I have a once a month standing brunch with some of my friends, and it's usually like a table of 10 to 12 of my friends. And what's really funny is they know I give out naloxone, and they know I'm involved in MAT. But what I decided to do, because we always try to give a little education and it's, you know, something with our get-togethers, make them meaningful. So I had a box of naloxone at everybody's place setting. and I gave them my spill. And, you know, I said, you know what? It came to my attention that I tell you about this, I give you one, but I don't give the demonstration. It's really important, you guys, when you go out to the community, handing it out is only one part of it. Always make sure that you demonstrate and make sure you talk how to use it, where the instructions are. In a crisis, people are not even going to know how to open the box. They're going to fumble. The stuff is going to come out. They're not going to know which end is up. I remember somebody saying that they know somebody who's sprayed it in their mouth because they forgot it was in the nose. So really take those steps in community education when it's just naloxone. Now, if you're talking about fentanyl test strips, make sure what is the one objective that you want everybody to walk away with. Same thing when you talk about syringe programs, same thing when you talk about overdose prevention, any type of harm reduction. Make it simple because it's a lot, as you see from this slide here. So in preparing for talking about harm reduction, I always want to go over and make sure there's nothing new or anything I'm missing. And the pillars of harm reduction, you guys know this stuff. People with lived experience and patients that are using, they are the experts, okay? And that's hard for some of our community people, right, to understand. So always remember, they are the ones, listen to them. Um, Always treat dignity and respect for people who use drugs. I know we hear a lot of stories that they were turned down for MAT or, you know, they were upset in the hospital. So again, if you're in that healthcare setting, even in the community, always be the role model. Community engagement, very important. Chaia talked about a lot of things and about advocacy, but community is part of your scope, your scope of practice. You know, definitely sometimes we can't even talk to the patient because they might have been overdosed, they're sedated. So a lot of times you are talking to family, friends, neighbors. So always make sure you know what message you want to get across. And then promote equity, rights, and reparative social justice. And I know you guys, these are a vulnerable population, and always make sure that you know that you are advocates for them. Make sure that harm reduction is accessible and non-coercive. We don't make anybody do anything, right? But we make sure that they have access to it. And then again, per Chaya's previous talk, patient-centered positive change. Always make sure that that is the focus. So what are some best practices for navigators, CHW, peer support specialists? Because we know we are all in the room together. Um, what are some best practices? This is where I know you guys are definitely the experts. I know one best practice for me, and sometimes I run out, but I always try to have a flyer, a pamphlet, something I can give to anybody, whether I'm in the community, I'm in the hospital, I'm at a collaborative, all of those materials, always have something. So that way that person can talk to you later if you don't have time then. You know, you had a great conversation. Somebody's talking about, yeah, I have, you know, my brother, and this happens everywhere because I go to schools and community events. I mean, I've had law enforcement come to me and tell me their personal stories about their brothers, their children. And so always be ready and have something. That's a best practice for me that I always share with you in your purse, in your backpack, because chances are you're going to have somebody that comes up to you. What do you educate uh, patients about harm reduction? Well, naloxone, right? That's really something that we want to make sure that they're safe with. So if they say they have a naloxone, do you stop there, you guys? Tell me what you do when they say, okay, I got that stuff. I have naloxone and fentanyl test strips. How do you approach the patient and what do you educate them? Safer using tools. Yes, you go through the list. I want you safe. Let's make sure you got all of these stuff and you know where to get them. Demonstrate use. Absolutely. how to use them. I love this. You see, I told you, you guys are the experts. We don't just stop at that because we know they may have questions and, they're afraid. They don't trust you yet, right? I think it's all about the trust. They don't trust you yet. So I like that. Make sure if they need more, they can reach out. Yeah, make sure they know. Keep them, on the path that they are educated, and use the start low and go slow technique. Lots of community members, family members have not heard this because we're busy training our patients. However, you start low and go slow. It's good for anybody in our community to know that you absolutely are high risk for overdose after an overdose, right? Or periods of sobriety or in recovery. So always remind people, start low and go slow. Just a real quick story here. My son is in college and he came home one day and he says, Mom, I know harm reduction. I just learned it. And he's focused on English and literature. So it was really funny for him to come home and mention that to me. He was trying to impress me. I said, well, what'd you learn? And he said, oh, my professor said, if you take anything from the street, you only take half because then that'll save your life and you won't overdose. So, it was funny because to me, it was like, that was so simple, but that stuck with him. I was thinking, I did all of these technical terms and talked to him. That stuck with him. So always know your audience and who you're talking to, because again, sometimes I can't get through as a mom. What else would you mention here? And I know I forgot to mention, if you need help with training video for naloxone as part of your naloxone grant, we are to take the California Department of Public Health training video, and that is what's in the chat. So please use that, watch it, put it on a QR code, give it to the community. That is the one to share. So anything else about educating your patients on harm reduction? All right. Okay, we're moving right along. Really quickly, part of harm reduction, of course, is stigma. And it's a best practice to make sure that we are reducing stigma and biases and stereotypes, such as people who use drugs are criminals. This is still going on today, right? With what's going on in our political skill, this is still people who are criminals and dangerous are taking drugs, right? This is still goes on right now. Beliefs that people who use drugs will never change. I had that belief. I converted 5 years ago, but people are still out there. Give them the time and the grace, because again, it's all about education and discrimination, right? This is really what you may see in our hospitals about making patients wait. I know one of the advocacy things is to make sure that you stay with the patient and say, hey, I'm going to wait with the patient until they can be seen. That speaks miles and building a trusting relationship with your patient. I'm using person first language. I know you guys all know this, so I'm not going to go over in depth, but you guys know if you have not used or do not have that lived experience of being a substance using substances, you cannot call yourself an addict. We have lots of people, navigators included, that do use that term. So I just want to be very, very, I want to say sensitive, because only they can talk like that. If you have not had a substance use problem, you need to use first person language. Why? It's respectful. So always be the role model for that. One of my favorite terms is they're a person in recovery. I love that term. All right. Anything else? We're going to move forward. Normalizing care. I'm kind of going to real quickly, do people still think that addiction is a moral failing? Absolutely. Make sure everybody you come in contact knows it's a chronic disease that can be treated with medication. So definitely we want to make sure. And where do you get those best practices? Here at CA Bridge, our buprenorphine algorithm protocol. That is the best practice out there. So pull it all together when you're educating, build those trusting relationships, provide care for, the environment that's carefree of judgment. Meet people where they are at. Does not mean everybody's going to agree with you, including the naysayers. If they're not ready, just move on. Maybe there's a friend, maybe there's a neighbor, somebody else. Advocate for patient-centered care, as Chaia said before, and know your resources and keep them current. This is part of advocacy as well, because we know a lot of our resources change. So I thank you. And like I said, you're the expert. You had all of this stuff in the chat. So thank you for letting me talk a few minutes here. And I'm going to go on to LaToya. She's going to be doing some bridge resources on our webpage. Go ahead, LaToya.
All right. So when it comes to educating patients with substance use disorder and people in your community, tools can really help you convey the message that you are trying to get across. And so super awesome that CABridge has curated multiple useful tools that you can use, which are completely free from our website. So I want to just give a demonstration to show what some of these tools are and how you can find them in the most succinct way. The first one, so when you come to our CABridge resources library, this is essentially what you will see. As you scroll down a bit, it shows that we have 131 resources now, which is super fantastic. And that might seem a little bit daunting to have so many there. Don't worry, I have a solution for you, and that is to filter by type. So before we used to really kind of emphasize searching by keywords. This makes the process a lot easier when you filter by type. So today, we're really emphasizing the importance of educating the patient and educating your community. So we're going to focus on patient education right now. And this is what we're filtering by. And you see that it dropped that 131 resources down to 21. It makes it much more easier and less daunting to filter through and explore. Then you could type in some keywords, but there's no need for that since there aren't as many right now. One of the main ones that I really want to just kind of point out is the guide to translated patient materials. So I'm not going to click it here because I have a tab already open. So I'm going to just show you what this looks like. So again, this is a guide to translated patient materials, meaning it's a one-stop shop for all the patient education materials that we have that have already been translated. And so they're translated by the most commonly used languages in our state. So you can come here and you say you are looking for translated youth-facing signage. They have that here. We have Spanish and we have Chinese. Say that you want to provide your patients with information on buprenorphine. Maybe they don't know about buprenorphine yet and they want to know some more information. You can come here to Buprenorphine What You Need to Know, which is a really great resource and breaks down what they would need to know. And here are all the languages that that specific resource is used. And another really great one, because Sherrie talked about this earlier, but how to use naloxone to reverse an overdose. This is what that resource looks like. But the great thing is that it is not only available in English, it's available in Spanish, Tagalog, Vietnamese, Chinese, traditional, and simplified. But this specific resource was created so that you don't have to reinvent the wheel and you can provide education to whoever, to the patient, to the family, to people in the community on what naloxone is and how to use it. And then on the second page, which is my favorite, because I'm a very visual person, it gives you the visuals of it. I know that the older Narcan boxes had that little flap that you could flip open, and it had pictures very similar to this. Sometimes that visual aid is really helpful, especially in a crisis situation where reading all that small text to figure out how to use Narcan is just, you know, too much to go through. And so the pictures kind of walk you through that. And it's very easy, very simple. You can print it out, it's in PDF, and use this. But again, the great thing is that it comes in so many other languages so that you can provide that information to many others in your community, depending on what, you know, some of the most common languages are. Let's see. So, oh, another really great one is I'm going to scroll down just a bit. So it's oh, sorry. Maybe I need to unfilter. So this one is going to be under all. But we're going to look at the trauma-informed care resource. This one I think is a hidden gem that we sometimes often forget about, and maybe some people don't know exist in here. But the trauma-informed care for opioid use disorder really walks you through how to initiate that conversation, the kinds of things to be aware of before you enter the room, you know, not asking specific things that may potentially re-traumatize the person, and just how you can really settle in that kind of empathy for what their past may contain, and still be able to connect with them. Another small thing that I want to point out is here under these filter and keyword search bars, we have this whole box here that lets you know where you can kind of go to get typically really quick turnaround responses if you have questions about, you know, maybe you have a provider that's like, I want to know and understand more about buprenorphine. I've never given it. I have some questions, or this seems like a little bit of a complicated case for somebody to you know, start Suboxone or something like that. You can connect with the National Clinician Consultation Center, and the number is here. So that is always there whenever you come to this resource page. And then, of course, the California Poison Control is available 24 hours. So no matter what time or day it is, they are available. But we highly, highly suggest that you utilize the resources that are available to you in here. Again, kind of going over a few other resources. There is a trauma-informed care, sorry, MAT and trauma-informed care in pregnancy. We understand that some of you are working a little bit more closely with, you know, people who are pregnant. So that is a really great resource to utilize. And then lastly, actually, I'm going to just type toolkit. So the substance use navigation toolkit, yes, we talk about this all the time, as much as we possibly can, because it is a fantastic resource. One of the things that I really want to emphasize, though, that I feel like maybe doesn't get as much attention is the appendix. So if you utilize the appendix often, definitely kudos for you. If you maybe weren't familiar with or didn't know that there was an appendix, this is some great information for you. But in our appendix, there is a number of different resources, some of which I actually just went over. So what do you need to know about MAT? This breaks down the different medications for opioid for addiction treatment. There's the buprenorphine, what do you need to know one. There is extended bupe. There's this bupe self-start. So this is great for patients who maybe don't meet criteria to start medication in the ED, or you know, if it's a street medicine, mobile clinic, or a doctor's office, wherever it is, if they don't meet criteria to start right then and there, you can, you know, still make sure that they have the information along with the doctor's prescription to do a self-start when they are ready. There's just so many things in here. Discharge instructions. So some of our newer ones may not be aware of that, but all kinds of really great ones. Safer drug use resources. These come from our friends at Harm Reduction. But again, some really, really great resources to go through. So I encourage you to take some time today if you can, but if not today, very, very soon, visit our website and explore the resources. See all of the resources that are truly at your fingertips, that can aid you in providing education to the patient and to those in your community. Now, let's see, I'm going to get over to our slides. Sorry, one second. So these are the resources. So just really briefly, we do have a knowledge check. We may not have too much time to go through these, but I'm going to ask you just two of the questions here. So the first one is patient-centered care. It's either true or false. You can enter in the chat. So patient-centered care understands that the patient is the expert of their own experience. Is that true or is that false? Whoo, you guys are fast with your responses. Yes, that is true. Very awesome. All right. So, number 4, we want to always use person first language, such as calling the patient an addict, an abuser, or a junkie. Yes, absolutely. So 4 is false. Definitely. You guys are really good. Very, very keen on your game here. Let's do one more. So I'm going to go to number 2. Reducing stigma around SUD is part of educating the community around patient-centered care. I see you guys already answering before I finish the question. Yes, that is true. You guys are phenomenal. Great job. All right. So just to kind of finish things out a bit, in our final few minutes, again, this is how you access our resources. Go ahead and take out your phone, scan that QR code, or we will definitely include the resources in our post-event email. But like I said, take some time to visit our resource library and see what great things you can find in there. Feel free to visit us at our CA Bridge Academy, which has a number of asynchronous trainings available for you, all the different modules. There are training modules for your prescribers, there's some for nurses, and there's multiples for our CHW, peer support, and navigators. You can always contact us at mentors@cabridge.org. We really pride ourselves in responding very quickly to those email inquiries. So please, whatever questions, comments, feedback, anything that you're needing, reach out to us at mentors@cabridge.org. These are our Navigator mentors that are employed by CA Bridge. So myself, Chaia, and our OG Navigator, Tommy. Also join us at on any of our social media platforms. There are multiples. One of them that is maybe not on here is also our LinkedIn. So join us there as well. We have, you know, a lot of really great things that we like to put. There's sometimes some really cool stuff that you'll see, including like little video snippets and things on our Instagram, which is fun. So if you're not joining us, please join us. And lastly, our really wonderful director, Sherrie Cisneros, this is her information, her contact. I kind of flashed over any Q&A, but since we have 2 final minutes, if there are any questions, feel free to enter them in the chat. So the question is, what is the email for mentors? So it's mentors@cabridge.org, which is now in the chat. Any other questions? All right. Well, thank you so much, everyone, for joining us, for joining our Navigator Focus series. We really enjoy having you in our audience. We appreciate all of the work that each of you are doing in your community, and have a great rest of your day.